People often believe that their physical pain, physical maladies that they experience are directly attributed to an injury or to some event that was a physical event that actually causes the pain that they experience. But I would like to challenge that thought, challenge that idea, because there's a lot of evidence that shows that that's not the case. That there may be a physical event, for example, a car accident, or let's say that somebody strains their back while doing yard work or by vacuuming the house or moving furniture. And they attribute the pain that they experience in their back or in their hips or wherever they feel the pain to an injury that they believe occurred during that specific event of the vacuuming or maybe just getting out of bed in the morning. All of a sudden they feel this pain and they felt something go kunk, like a snap or a pop or a feeling of a surge of pain going through the body in one particular area. And they associate that pain with a potential strain or some other, maybe an impact or something like that, that actually they believe is the physical cause of the pain. And therefore it's an injury that they suffered that is causing the pain that doesn't go away. So maybe they have had this pain for several weeks or months or even years, and they attribute that pain to this specific instance, this incident that happened, because obviously that must have been when I got injured and now the pain doesn't go away. But realize this, the body is designed to heal itself. That means that when there's an injury, once the injury heals, once the strain is healed, once the aggravated nerves from, like, let's say it was a muscle strain, or it even could be some kind of tendon extension or strain, that once that is healed, the pain should go away. And if it doesn't, then that means that aggravating event, the physical event, is actually not the cause for the pain in the first place. That physical thing that you believe actually is causing the pain is probably just a triggering event that is enabling you to associate pain with a specific physical or mechanical thing that happened to you, when it in reality is associated with an emotional issue that you haven't dealt with. So consider for a moment that at the time that you experience this pain, this physical trauma, that there may have been something going on in your life. If you review your thought patterns, the concerns that you had at the time, maybe the environment that you were in, and the emotional issues that you were dealing with at the time, you may be able to identify the particular feelings that you had that perhaps you were suppressing, and therefore your unconscious decides to manifest it in physical pain because you aren't dealing with the emotional. And I would suggest that you can actually heal the physical pain, by going into the motion that is associated with it. So one way to do this is just to ask yourself, what emotion comes up when I think about this physical pain? What is the emotion that I associate with this physical pain? And it could be fear. It could be insecurity. Maybe feel disabled or maybe not good enough. Maybe not physically able. Maybe you feel like you're just not strong enough. You're too weak. But there's emotions. Maybe you feel, I'm trying to think of the word, but there's probably some emotion, and you may feel the emotion, and maybe you can't even express what it is in terms of sadness, anger, grief, jealousy, or some other fear or something like that. Maybe it's just this sensation, this feeling that you have in your body that's associated with that physical pain. And if you go into the pain, if you just focus on it, and then ask yourself, what is the emotion that comes up as I focus on this pain? And just wait. Just meditate on that. You may find that your unconscious mind will bring up some kind of emotion that is actually associated with that physical pain. And then once you identify it, you can begin to work through it by asking yourself, can I let this, whatever it is, grief or fear or whatever, can I let it go? Would I let it go? When could I let it go? So try this. Go into your physical pain and really put your attention on it and ask yourself what emotion comes up as you focus on the physical pain. And then when you have that emotion, really ask yourself, could you let it go? Could you let it go a little bit more, and a little bit more, and a little bit more? And then keep asking yourself that until you feel the emotion begin to subside. And then notice that you may even see that your physical pain begins to diminish. And if it doesn't completely go away, go into it again and ask yourself again, what is the emotion that is attached to this remaining pain that I feel? And then go through this process of release. Could I let it go? Could I let it go a little bit more and a little bit more, and focus on the emotion? By doing that, I think you may find that your emotion that's associated with that physical pain, as it depreciates, so too will the physical pain diminish. And this is one way to heal yourself of physical pain that you probably thought was chronic and you would never get over. But the first step is just opening yourself up to the idea that your physical pain is not due to a mechanical injury, that your physical pain is actually due to an emotional trauma that you need to heal. That's all I leave you with today. Ciao.